Hi, I'm Akhilesh Rathanam and I'd like to welcome you to This is Medicine. So This is Medicine, as some of you may know, is a webinar series where we'll be focusing on a different specialty each session and looking at what it takes to excel in those specialties, any different tips or advice on how you can maintain a healthy work-life balance in a career as stressful as healthcare, but also on any potential misconceptions that might surround them. So every session will consist of a parent and a child, and the last session we spoke to Mr. Sunil Budhia, who is a consultant cardiac surgeon, and he spoke with his daughter Sanjani, and you can find that video linked up here. And this session we'll be speaking to Dr. Rupa Jeyaraj, who is a consultant anaesthetist, and her son Paul Sundaram, who is a medical student at University of Birmingham. So they'll be being interviewed by our in-house medical student Akash Rathanam, and he is at King's College London.
So thank you for joining me today, Dr. Jeyaraj, and thank you for joining me today, Paul. So we are here today to discuss what being an anaesthetist is like. So I'd just like to ask Dr. Jeyaraj. So a lot of our viewers are prospective medical students, sixth formers, quite young people. So can I ask, what is an anaesthetist, just for everybody in the audience?
So thank you for this this event which you're organizing, Akash. So an anaesthetist is a specialist doctor who actually has quite a lot of experience, obviously post medicine, MBBS, and who obviously makes sure you're alive throughout the operation, wakes you up. And not only that, so we are not just putting people to sleep, but we are now diverging into perioperative medicine, obviously critical care, pain medicine, and some of them even into sports medicine.
Right. So I'd just like to ask, how did you arrive at becoming an anaesthetist? How was your journey there?
So I obviously did my medical education in India, and I think I was just very much when I was in the surgical block, and when I saw this anaesthetist, I just felt like they were the appropriate people in any emergency. They had the skills, and they were the ones to go to in an emergency, like whether it's cannulation, airway skills. So I think that on the job, the procedural skills, and they were usually a friendly bunch. So that what attracted me to it. And another thing that attracted me was what you are learning in medicine. What I learn, I use it straight away. So it's not like, you're studying about a drug and then you prescribe it to someone and you see the effect in a week or two. It's not like that. I can see the effect of the drug straight away. So that was one thing which really attracted me to the job. I think it's just everything. It's the emergency going. You are there to save a life, and that really attracted me. Yeah.
Mm. So when you say that you immediately get to practice what you learn, it was just the way that you immediately get to kind of take what you've spent all that time doing and put that skill into action quite soon. So how do you mean, how is the pathway of training to become an anaesthetist?
So you do after you finish your MBBS in the UK, so you have 2 years of foundation program. In the 2 years, some people choose to do anesthetics for 4 months. So those are the ones who have some idea, or it's completely the other way around. People who actually don't know anything about anesthetics want to do it to have a flavor of it. So in that 4 months, you get a flavor of anesthetics. We obviously, you're supernumerary. We don't allow you to do anything on your own, but it really, really is a useful way to know about anesthetics and critical care. Then after that, there are 2 stems in the UK. So you can go through the ACCS pathway or the core training. So the core training is obviously, some of them with the ACCS, they are not very sure. So they want to try they want to try the medicine STEM. And some of them are very sure. So they obviously come into the anesthetic training, which is core training 3 years, which is the stage 1. Then we say stage 2, which is specialty training, ST 4 and 5. And then 5 and 6 is stage 3. So you complete those 7 years of training and you are a consultant anesthetist. During that time, you have to pass your primary FRCA and your final FRCA. A word of caution, but it's really good exams, but they are not the easiest exams to pass in the UK. We do a lot of physics, we do pharmacology, physiology, all the basic sciences, and then obviously, other parts of medicine for anesthesia. But 2 tough exams, but worth it. So as a consultant, you need at least 7 years of training in anesthesia, and the final FRCA. Once you've passed, then you go on to the CCT, which is the completion of certificate of training for anesthetics, and you get into the specialist register.
Right.
So, wow, I would say the training does definitely sound hardcore, but
Yes.
definitely enjoyable. What would you say, I'm sure all the other members, as myself, are intrigued. What is a classic day-to-day life, a life of an anaesthetist start with? How does it end? What feelings are you having during this whole day?
Yeah. So in the morning, it starts quite early. So we have to do, it is a long day for us. A normal day is a long day. A normal day in the life of an anesthetist is 8 to 6. So we start off with the preoperative assessment. So we go and see the patient. And that's another little, a very nice thing in anesthetics is within that 5 to 10 minutes, you do the preoperative assessment and you have to build a rapport with the patient and actually make them say that, okay, I'm in good hands. I'm going to, be awake after the operation. So it can be a minor operation and it can be a really major one. So it really depends on what people do. People do subspecialize as well. I'm an obstetric anesthetist. Some people do a critical care. It's now changed a little bit more. So people go into critical care straight away. They do chronic pain. Some of them are a cardiothoracic anesthetist. So there are subspecialties as well. But for any surgery, so we usually tell them, we pre-assess them, we give them the confidence that they will wake up after surgery, because the reason I tell you this is at least every other patient will ask me, am I going to be alive after the operation? I have 3 kids. I want to see my grandkids, things like that. So we have to reassure them. And then we obviously have a team huddle. We call the WHO WHO checklist, where we have the surgeon, the anesthetist, the surgical juniors, the anesthetic juniors, theatre staff, the healthcare assistants, and medical students. So we introduce each one of them, introduces themselves, and everyone listens to what goes through, what we go through stepwise as to what patient we're going to do, how we're going to do it. So it's a really nice way of medical students as well trying to understand the theatre environment. So the patient, we check them many times, and this is really good according to the WHO checklist. The reason is, even with these checks, there are never events. And what we call never events are like a wrong side surgery. So if the kidney has to be removed on the right side, and if it is removed on the left side, then you are obviously not removing the kidney which is faulty, but you're even removing the normal kidney, which is working. So it is a never event. So that's why we have so many checks. We have checks with umpteen number of team members, and in the checks, always the surgeon and the anesthetist are included. So we check the patient, then I start the anesthetic. The anesthetic usually is a general anesthetic with, it could be general anesthetic or a regional anesthetic. So, and sometimes we combine a general anesthetic with a regional anesthetic for a major surgery so that it is good for pain relief. But a general anesthetic can be for a minor procedure for like 5 minutes, or it can be for a major procedure like cardiothoracic surgery for more than 4 or 5 hours, or some surgeries like involving multiple teams can go on even for 8 to 9 hours. So the general anesthetic is the same. The patient is totally unconscious for the duration of the surgery, whether it's 5 minutes or 8 to 9 hours. They're totally unconscious. We take care of the pain relief, and they don't move, obviously, for surgery to happen. And I think because anesthesia has evolved so much, surgery has evolved so much as well. because surgeons are able to do so much because anesthesia has evolved. So it's like, it's like a real good cycle. Both have evolved together. Otherwise, they can't do their surgery, and we cannot obviously evolve in medicine, as in cancer surgery mainly. So we make sure the patient is alive with gases. That's why they call us the gas man or the gas woman. So we call it the inhalational anesthetic agents. Or nowadays, we have a total intravenous anesthetic, which is called TIVA. But just to keep it simple, a patient is kept asleep via gases or via the intravenous anesthetic. And throughout the surgery, the patient is fully monitored. So for the medical students and the sixth formers, I would say the three essential ones are: we always check the saturation. You'll all know oxygen saturation. We check the heart rate always. So the ECG is on, and the blood pressure, the non-invasive blood pressure. But obviously advanced monitoring, we go on to invasive blood pressure monitoring, like we do put in an arterial line, we put in a central line in the neck, we do full-term cardiac output monitoring. So these are advanced, but the basic ones, like if you come for a little lump and you really need a gel anesthetic for that, we still do the monitoring, as in 3-lead ECG you would have seen in the wards, heart rate, which comes with the 3-lead ECG, the saturation, and the blood pressure monitoring. So obviously at the end of surgery, we make sure the anesthetic gases or the anesthetic which we have given are cut down. We make sure the patient is breathing for themselves. We take them to recovery, make sure they're not bleeding, they are breathing properly. I'm just saying a couple of things. So we make sure the patient is fully awake. They can talk to you. They can answer your questions, and then we come to theatre and we start all over again. We start checking the patient. We start off with the venous cannulation, giving them fluids and the whole thing. So our day finishes around 5:30, 6. We make sure the patient is obviously, again, awake, alert. In the last patient, we hand over if we have to hand over, and then obviously we come home. During the day, a minor surgery list can be stressful as well, because we do 8 or 9 patients. A major surgery can be stressful in different ways. The patient can bleed. We can have so many other problems. So, it's a mixture. So we do anything from a simple kind of, lumps and bumps, to airways, to the parotid, in the neck, to GI surgery, cardiothoracic surgery, liver surgery, orthopedics, obstetrics, gynecology, community dentals. We anesthetists are needed in radiology. We are needed everywhere. So we are the biggest department in the hospital for the various regions, pediatric anesthesia, or everything. So we cover, I think we are part of many, many teams. That's all I would like to say. Yeah. I don't know, anything else you wanted to know, Paul?
No, I think that was more than enough. I learned a lot in that, more than I learned in my own lectures at university.
Okay, that's good to know. Yeah.
You mentioned a lot there, Doctor. You mentioned a lot about how you needed to have a lot of hard work and commitment to be an anaesthetist, coming in at 8 in the morning, leaving at 6. How routine is really important, and also how you have to work with all sorts of variety of surgeries, whether that's routine hand surgeries, or for, like you said, major surgeries like cardiothoracic surgery or kidney removal, transplant, and things like that. But I was just wondering, what sort of skills do you really think separates an anaesthetist from other doctors? Some things that anaesthetists excel at.
So I think anesthetists excel at kind of thinking on the spot. So if there's a real airway emergency or a really big bleeding, you really have to take ownership and lead the team. So you really have to think on the spot. And obviously, the training really helps you, and nothing like experience. So that's why the training is so very hardcore, as you said, and very thorough. The exams are really hard, but thorough. And I think we actually put into practice what we are reading for the exams as well. So that way it's really good. I think you have to think on the spot. You have to deal with the situation. Yes. So the training helps you, as I said, but we always, at the back of our mind, we have a plan A and a plan B. Always. Okay, what are we going to do? So we are not just going, oh, things will be fine. We are always having a plan B. And when we get trained as well, our consultants are always asking us, what is your plan B if things don't go well? So, and that's how we train people as well. So I would say leadership, thinking on the spot, acting very quickly. And I think the procedural skills. You're out and about. You are constantly on your feet all day. You are doing stuff, whether it is a simple venous cannulation, airway skills, whether it is a spinal or an epidural, or whether it's an arterial line. We are doing a lot of stuff. And, we are dealing with all sorts of things that can happen to an individual, whether it is, a person collapses in the middle of the road, we can give advanced life support, or to a patient in obstetrics, for example, when they come rushing to theatre, when we need to deliver the baby very quickly. So I think it's the full skill set, I would say. It's the full skill set that separates you and a person who is willing to do, obviously, the odd hours, the difficult hours. So we really have to think on our spot at 4 a.m. in the morning, as well as 2 o'clock in the afternoon. I think that's what, I think that's the both stressful and the beautiful part of being an anaesthetist. Because you do save a life. So that's really, really important at the end of the day. Obviously, not just as an anaesthetist, but as a multidisciplinary team member. Yeah.
So it seems that from my point of view, is what you said, an anaesthetist, one, you said always has to be ready, acts like a safety blanket for the entire procedure, for everything that they're involved in. Having to think on the spot, having to always be ready, regardless of the time. I think that's quite inspiring, especially considering the broad nature of the things that you would be involved in. But I have to ask, it does sound really stressful, as you've said, but what do you do outside of medicine just to, take your mind off things whenever you need?
Yeah, that's an interesting question. And I really like the safety blanket you mentioned, Akash. What I would say is, we've looked at the neurodiversity of anaesthetists as well. So there's quite a lot of work being done now, and anaesthetists are kind of OCD because we are constantly checking how we, is the patient breathing properly? The anesthetic gases are on, the airway is okay, the IV cannulation, and we obviously, with really difficult surgery, we have to position people, and with robotic surgery and everything, has to be done in an order. So we are a little bit OCD. So they say OCD kind of people are attracted to anesthesia, and then once you get into anesthetics, you're a bit more OCD, which is good, I think. But, I'll just leave it at that. I'm not going to dwell on that, but I would say anesthetists, many of them are, at least in my department and the departments I've worked in, many of them are keen cyclists, and they are kind of adrenaline junkies, especially the men. So we do all have a lot of hobbies. So many of them are keen cyclists, the mountaineers, some of them. I think for me personally, I'm not a keen cyclist. I think we are quite outdoor, all of us are. So I enjoy walking. I enjoy socializing. I really enjoy socializing, entertaining. My son would tell you, your mother would tell you as well. I think being with people, being with friends and family is something which I really enjoy. And I think that definitely takes the stress off you. And I love traveling. So with family and friends. So I think each of them have something to take their mind off.
Say that was quite interesting in how you were explaining that certain personality traits can match up to sort of career that you want to go into, what you want to specialize in. But for yourself and other anaesthetists, I guess, what would you say is the best part about your job, but also the hardest part, so we can see the realities of this career as well?
I think the best part is when you are in a real emergency, like I would say a bleeding emergency, and you are there, you go and deal with the patient. You are the first one who literally responds, among others. And we obviously take over as anesthetists, lead the whole team. And then when you get a really good outcome, and whether, it's a obstetric patient bleeding or any other patient, and then you go and see them in the ward or in the critical care, and you've done everything for them, that I think it's really very rewarding, very reassuring, very rewarding. That is the best part. I think the most stressful part is you've done everything, and still, obviously, you have to deal with the bad outcome. But that's the thing I would like to say, is at least you have to try your level best as part of a team. And then, and it still affects everyone, I guess, when you've done everything you could, because it's an emergency field. So we do get that as well. So you do get a bad outcome, and you have to deal with it. And constantly in our field, we are trying to reduce the bad outcome, but sometimes it does happen. And I think that's the stressful bit and the difficult bit.
So I'd just like to thank you. I think we're coming up to time, but I'd just like to thank you so much for this this insight. It was really something to I think my favorite part of your talk was when you discussed like being in an emergency and being in a true emergency, because there's the element of, as you mentioned, anaesthetists can be adrenaline junkies. There's that element of, I'm here in this moment, I can do something. And I love doing that. I love saving lives and I love helping people. But then there's also the reality of, oh, I can't do anything past this point. What do I do? And I think there's that really beautiful balance there that you've really struck when talking about being an anaesthetist. And I just wanted to reiterate that. But I just wanted to say thank you for agreeing to talk to everybody here. And thank you, Paul, for some really engaging questioning as well.
Thank you too.
Yeah.
Thank you, Akash, and thank you, Paul. And I hope, Akash, your show is really helpful to many of the medical students out there across the world.
Thank you
and
so
school
much.
students.
Yes.
So I think we can wrap up there. Thank you, everybody who decided to watch, and I'll hopefully see you next time.